Differences between Ontario Health Insurance Plan and Private Health Insurance Card. In this workshop, we will discuss the differences between the Ontario Health Insurance Plan and Private Health Insurance Card. What are the benefits they have, and how and when we can use them. We are hoping that this information may help you to learn more about it. Ontario Health Insurance Plan. Eligible workers living in Ontario receive free health care through the Ontario Health Insurance Plan. To get an Ontario Health Card, you need to apply on it, and once approved, automatically you are already covered by Ontario Health Insurance Plan. Every time you see a doctor, visit an emergency room, have a medical test, or go for a surgery, you need to ring and show this OHIP card. The Ontario Health Card usually takes about 3 months, but you can still get health services sooner. You can get health services from the day you arrive in Canada. If for some reason you pay for health care while you are waiting for your card, the Ontario government will reimburse the amount if you have a work permit and are eligible. The Migrant Work Community Program can help you apply for your health card at Service Ontario at 24 Seacliff East, Unit 450, Leamington. Ontario Health Insurance Plan covers part of or all of the following services: visits to doctors, hospital visits and stays, laboratory testing, community labs or hospital. For example, when you need to go to the hospital to see the doctor, you only need to show your Ontario Health Insurance Plan card. You can also use your Ontario Health Insurance Plan card for blood or lab tests. If you are pregnant, you can get all the health services you need for your pregnancy. Services not covered by Ontario Insurance Health Plan. OHIP does not cover prescription drugs, dental services, laser eye surgery, cosmetic surgery, eyeglasses, or contact lenses. You can use your health card as a form of identification for other reasons, but no one else can record or copy your health card number. If your health card number falls into the wrong hands, it could be used to access to your personal health information or for your health card fraud. Private Health Insurance Card. The plan can pay for some cost not covered by Ontario Health Insurance Plan. You can pay for these plans by paying a certain fee each month. Usually, your employer will pay for part of the cost and you will pay the rest. These include different plans with different packages. Many private health insurance plans pay for semi-private or private room in hospital, chiropractic or physiotherapy, vision care, prescription drugs, dental services, mental health support services, speech therapy services, travel insurance. Coverage amounts for a private health insurance plan in Ontario depend on which plan you are getting: the basic plan, the temporary plan, the extended plan, or major services. Each plan offers different coverage for all of these services that you need. If you need to stay for some days in the hospital, private insurance covers a semi-private or private room in a nursing care. If the doctor prescribes medication for any treatment that you need, having a private insurance, which covers the pharmacy services, you can purchase the prescribed medicine without paying the total cost. For example, if the insurance covers 80%, you only have to pay the remaining 20%. If you have your private insurance and you need to go to the dentist, insurance generally covers 80% of the service you request. For example, if you need cleaning, x rays, or extractions, you only have to pay the remaining 20% of the total price. But it all depends on what kind of plan you have. These are just some examples of how you can use your private insurance for each service you need. Your insurance covers a certain percentage depending on your plan. Each service has a specific amount that is consumed when you use these services.